Good morning, Mrs. Swift. I'm Vanessa Rico. I will be your nurse today, and I'm going to be performing your central venous access device change, okay? So before we get started, I'm going to quickly check your identification band, okay? So may I have your name and date of birth? Okay, Allison Swift. Okay, January 9, 2003. Okay, perfect. That matches my record and that matches your wristband. I'm gonna ask you some few questions, okay? Do you have any allergies, like chlorhexidine or latex? No? Okay, that's perfect. Okay, and have you had this procedure done? No. Okay. Well, a special thing about this procedure is that both you and I or anyone else in the room have to mask. As you can see, I have my mask on already. And before I remove the dressing, I will ask you to put on a mask too. I will also ask you to turn your head to the left, okay? We want to prevent any sneezing, coughing, or any of that sorts from getting onto the site, okay? And I will explain to you the procedure. So I'm going to first start off by wiping down my surface. I'll be doing that for 30 seconds, letting it air dry for 2 minutes. Once that is done, I will go ahead and grab my supplies, and I will hand you a mask and turn you to the left, okay? Once I have my supplies ready and all, we will start by removing the dressing, and then I will remove the little blue patch, also known as the biofilm. And once that is removed, I will go ahead and begin the sterile process. So I will put on sterile gloves, and I will go ahead and use a chlorhexidine foam brush to clean around the site very well. I want to prevent infection or any bacteria from getting in there, okay? And then once that is all nice and clean, I will go ahead and put on a brand new dressing, okay? Does that sound good? Yes? Do you have any questions or concerns about the procedure? No? Okay, let's go ahead and get started. I'm going to go ahead and perform hand hygiene for 20 seconds. So 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 20. Okay. I'm going to go ahead and grab a pair of gloves. I will go ahead and grab a wipe. I'm going to go ahead and clean this for 30 seconds. So 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 2, 23, 24, 5, 26, 27, 28, 29, 30. Okay, I'm going to go ahead and throw this away and dispose of my gloves. And I will be performing hand hygiene for 20 seconds. Okay, now that I performed hand hygiene, it's time to grab my supplies, okay? So I'm going to go ahead and grab my supplies here. So here I have a bio patch. I'm going to set this down. I also have a new dressing or a server view, and I'm going to go ahead and open up the dressing tray. So I'm going to carefully take out my gloves, my sterile gloves. And here, Mrs. Swift, I have a mask for you. Okay, I'm going to go ahead and put this on you. And can you turn to the left for me? Thank you. Okay, I'm going to carefully grab my supplies and drop them into the sterile container. Okay, the bio patch went in. I'm going to go throw that away. And I'm going to carefully grab the ServaView and carefully drop that in as well. Okay, I'm going to dispose of that. And then I'm going to go ahead and perform hand hygiene again. Are you doing okay, Mrs. Swift? Yeah? Okay. Just making sure. Okay, I'm gonna go ahead and put on some gloves. And I'm gonna go ahead and start removing the dressing, okay? Are you ready to begin, Mrs. Swift? Yes, okay. So this is like a bandage-like material, so you shouldn't feel any pain, but you might feel some discomfort, okay? If you feel any pain or anything, just let me know, okay? I'll try my best. Okay. This is very sticky. I'm gonna try to stabilize the catheter while I remove this. This is very sticky. It's pulling my glove off. I'm going to go ahead and hold the side of the vial patch. You want to make sure, you can hold the sides of the vial patch, you just want to make sure that you don't touch the middle part, because you don't want to put pressure on the inside, okay? So since I took the film off the bandage, I'm going to quickly inspect the thingy. So there's no redness, there's no signs of infections, the tube isn't cracked, leaked, and it's still at the 30mm mark. Still at the 30 mark. Okay. So everything appears to be fine. I'm gonna go ahead and take my gloves off, and we're gonna begin the procedure for the sterile. I'm gonna go ahead and perform hand hygiene for 20 seconds. Now that I did that, I'm gonna go ahead and start putting on my gloves, okay? Carefully open up my gloves, making sure to only touch the inner 1-inch fold. I'll go ahead and carefully insert my hand. However, these are a little tight. I'll make them mark. Okay. I'll fix the cuff after. Okay. So these are very tight. I want to be sure to not break. Sterile. Okay. I think that's fine. I just need to fix my fingers and fix the cuff. These are very tight. Okay. So I will gently roll back the cuff, making sure to not break sterile. These are, the cuff is folded in, so that is not breaking sterile. Okay. I will then be grabbing a piece of gauze to hold up the catheter, and then I will go ahead and crack the chlorhexidine brush, and then I will go ahead and clean the site for 30 seconds. So 1, 2, 4, 5, 6, 7, 8. 1, 2, 3, 4, 5, 6, 7, 8. 1, 2, 3, 4, 5, 6, 7, 8. 2, 3, 4, 5, 6, 7, 8. So 1, 2, 3. I'm going to go ahead and throw this away. Now we're going to let it air dry for 30 seconds. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Okay, I'm going to go ahead and grab the bile patch like a little taco. Go ahead and carefully insert that. Okay, I'm going to set this down carefully, and I'm going to go ahead and take the new dressing, okay? So I'm going to go ahead and, so there's this stress slip already that I made. I'm going to go ahead and center the bile patch. Okay, before I throw this away, I'm going to make sure to take this little tape off, throw that away, and I'm going to write today's date, the time, so 5/28, and then I will write my initials as well. Go ahead and stick this on here. Okay, and then I'm going to go ahead and throw this gauze away, and I'm going to remove the backing of this as well. Press down, make sure that there aren't any bubbles, and I'm going to go ahead and throw that away. Next, I'm going to go ahead and secure the thingy by putting the hub guard, which is the pants. I'm going to go ahead and carefully put that on, throw this away, and then I'm going to go ahead and lastly put the tape on. Okay, now that I put the tape on and the dressings all on, I'm going to go ahead and remove my gloves and perform hand hygiene. One last time. Okay, Mrs. Swift, you're able to turn around now. How was the procedure? Are you okay? Are you in any sorts of pain? You can take your mask off. Okay, I will. Thank you for removing your mask. Okay. So, Mrs. Smith, how did the procedure go? I think it went pretty smoothly, if I don't say so myself. Yeah, I agree. I didn't have any pain. Oh, you didn't have any pain? Okay. That's good to hear. Do you have any questions or anything before I leave? No? Okay. Okay, before I go, I just want to make sure that I document that the patient tolerated the procedure. There weren't any signs of infections, no redness, no cracking in the tube, no nothing. And the catheter length remained at 30. Okay? So, thank you, Mrs. Swift, for letting me change your CBAD dressing. Have a nice day, okay? Thank you. Okay, you're welcome. See you later. Have a nice day.